Right. So, welcome again. Welcome all of you. We are here back with another webinar, with another session with Dr. V.M. Kohli. In fact, when we were doing the series with Sir, so many doctors were interested in taking it in many other topics and many other subjects. But due to some, I think, personal engagement, Sir was not available for a few months. But now, again, he's back with us and hope we will be having him regular on our platform. And today we are doing this national webinar. Specifically, we'll be talking about the hypertension aspects, and Dr. Kohli will definitely share his experience, his learnings with all of us. And we are again thankful to the entire team from Dabur. We have Mr. Anuj, product manager from Dabur. So thank you so much, the entire Dabur team. Dr. Durga Prasad, under his leadership, the entire team is very much interested and focused to connect with the doctors and to spread and disseminate the knowledge and information which should be required for all the clinicians and the practitioners. So I know that all of you are waiting to eagerly listen, Dr. Kohli. So without wasting much time, I will hand over the session to Mr. Anuj for the proceedings, and I request all of you for next 40-45 minutes. Dr. Kohli will deliver his talk, his presentation, and all of you can send us the queries, questions. Meanwhile, you can post as soon as sir will conclude the presentation. We will take up the questions and queries, and we will discuss that accordingly. Thank you so much again for joining. Right now, we are live on YouTube, Facebook, LinkedIn, and many other platforms. And I hand over the session to Mr. Anuj for further proceedings. Thank you.
Well, many thanks, Dr. Piyush. It's a pleasure to host the webinar and kind of moderate this session. From the entire family of Dabur India Limited, I welcome all the doctors, Vaidyas, channel partners, and everybody who has joined us on this webinar on 18th of June on the topic of holistic management of hypertension. Well, hypertension, we all know, is a very, very challenging problem, a challenging disease, primarily because it does not usually occur in a single condition. So it is usually present with many other manifestations and many other problems, right? It's a comorbid condition. And today we are very lucky to have Dr. Vijay Mohan Kohli to kind of throw the insights with his enormous canvas of experience that he has over more than 3 decades or 4 decades rather. And Dr. Kohli needs no introduction, by the way. He is a specialist in adult cardiac surgery with experience of over more than 8,000 cardiac operations within India and overseas at the University Hospital Uppsala in Sweden. Dr. Kohli was instrumental in setting up cardiac surgery departments and initiating cardiac surgery in India in various top-notch hospitals like the Escorts Heart Institute, Batra Hospital in New Delhi, the Hero DMC Heart Institute in Punjab, Ludhiana, and Sri Balaji Action Medical Institute in New Delhi, and Arjuna Heart Institute in Nagpur. He actively practices and promotes holistic medicine, which includes spirituality, yoga, meditation, and naturopathy. And Dr. Kohli is very passionate about integrating Ayurveda, naturopathy, and other complementary systems into the mainstream of medicine. Dr. Kohli has also received multiple honors, including Distinguished Person Award from the Old Martinians Association in 1999, having excelled in the field of cardiac surgery. Dr. Kohli has also received Certificate of Merit from Apollo Hospital for conducting 1,000 open heart surgeries and for his contributions towards successful completions of the open heart surgeries, and a Certificate of Appreciation from the Old Martinians Associations Australia in 1999. Dr. Kohli, we are fortunate to have you on the webinar, and I'll request you to please take over the session and throw some insights about the holistic management of hypertension. Over to you, Dr. Kohli.
Uh, Thank you very much. Namaskar to all of you. My regards to Piyush ji, Anuj ji for introducing me. Uh, I think we'll just go ahead because there's a lot to discuss about. We know that hypertension is a silent killer, rightfully so. Everybody knows what blood pressure is, so I don't think I should spend too much of time on that. But I had the slide, but I'm not going to talk much about it. Now, why is blood pressure important? because as Anuji very rightly said, it is usually associated, high blood pressure is usually associated with many other conditions and complications. For example, heart attack, heart failure, strokes, blindness, kidney failure, aneurysms, and there may be some more. Now, normal blood pressure, I think all of us know what normal blood pressure is. We take 120/80 as normal, but anything between 90/60 to 120/80 can be considered normal. Now, when do we call a person hypertensive? Now, there have been different schools of thought, but at this point in time, what we normally assume and accept, we call a blood pressure elevated when the systolic is between 120 to 129 and diastolic less than 80. We call it hypertension stage 1 when systolic is between 130 to 139 and diastolic between 80 to 89. Stage 2 when the systolic is more than 140, diastolic more than 90. This is the usually accepted one, but we still, in fact, I also follow the earlier classification, which most people do. That is mild, moderate, and severe. Mild being systolic between 140 to 160, diastolic between 90 to 100. I think everybody is aware of this, so I won't spend much time on this except by saying that anything beyond systolic of 180 and diastolic more than 110 is a medical emergency, and of course that needs to be tackled very well in good hospitals. And obviously we don't have to wait for this type of a thing to happen. We have to take recourse to certain things before this happens. Now we all know that hypertension is basically of two types. One is of course essential or primary or idiopathic, which occurs in about 95% of people, and 5% we have some known cause. But even in those where we call it idiopathic, there are a lot of associated factors, and many more are getting added up, which we're going to discuss in fair detail. Stress, of course, is considered to be an important factor. Cigarette smoking, alcohol intake, excessive salt intake, diabetes, obesity, our genes, vitamin D deficiency, deficiency of magnesium and vitamin K. And as far as the secondary causes are concerned, we know that brain or renal tumors, renal artery stenosis, coarctation of aorta, these are the classical ones. But in addition to that, there are certain drugs which can lead to hypertension if they have been used for a long time. For example, non-steroidal anti-inflammatory agents, steroids, nasal decongestants, anticholinergics, which are very frequently used. And of course, the blood pressure varies because of excitement, because of anxiety, because of anger, and so many other factors, which all need to be taken into account. Now, there are many factors which I think for some reason something happened and we moved on to something else. Okay. Now, of these factors, one factor which is not always considered, not even thought of, is that thyroid conditions are also causes of hypertension, both hypothyroidism as well as hyperthyroidism. But fortunately, the hypertension which occurs in these two conditions is generally mild. The issue out here is that diagnosing thyroid problems is a big question mark, because all over the world, people focus only on the T3, T4, TSH, and if the TSH is beyond a certain limit, people are diagnosed as being hypothyroid. The catch here is that what the lab report mentions as a TSH level of the upper limit being about 4.5 to 5 is actually erroneous. The correct thing is that the TSH level should not go beyond 1.5 to 2. Anyone having more than that should be assessed in more details to confirm or exclude the diagnosis of hypothyroidism. The reason being that 82% of patients go undiagnosed with hypothyroidism because everyone focuses on the TSH levels. And basically, the principle in mainstream medicine is, and with endocrinologists is, that if the TSH level is less than 10, they do not start treatment. But unfortunately, by the time it reaches 10, a lot of the thyroid has already been destroyed. This is very unfortunate. So one has to take recourse to two more things. One, that if you suspect thyroid in any case, you must always do the thyroid antibodies, because a lot of patients have high antibodies, which means they may be having either Hashimoto's disease or they could be having Graves' disease. But the most important test is what is known as a thyroflex. It is a thyroflex which is based on neurotransmitters and its assessment, which gives us or clinches the diagnosis of hypothyroidism or hyperthyroidism. Now, what happens is that in hypothyroidism, it is predominantly systolic hypertension, while in hyperthyroidism, it is predominantly diastolic hypertension. Then another factor which is not considered at all is the role of the oral health and its role in cardiovascular disease and hypertension. This is something which is being completely overlooked because predominantly most of us do not examine the oral cavity. We do not understand the importance of the oral cavity, and this is the reason why we're missing out on a lot of things. Now, I'm quoting Dr. Gerald Curotola, who's a big name in biological dentistry. And according to him, 25 to 90% increase in risk of cardiovascular disease is occurring because of severe periodontal disease, which we are overlooking or we are missing it. Now, why is it important? Now, whenever we eat leafy green vegetables, they have nitrates in them from the soil. The nitrates in the body get converted into nitrites. The nitrites, when they go into the stomach, get converted into nitric oxide. And the nitric oxide, as we now know, there have been a lot of Nobel Prizes given for this particular molecule. So when nitric oxide is produced, it is very important for our vascular health. So if that is less, then we can have problems. Now, at this point, I want to tell you another thing. Now, whenever we use antimicrobial mouth rinses, which is advised by both dentists and other physicians also, what happens is that it reduces the level of nitrites in the body. When that gets reduced, nitric oxide also gets reduced, because of which the arterial health suffers and becomes a factor for the production of or the development of hypertension. We should remember that. Then role of salt. Now, this is another very vexed issue. What happens is, 90% of the people in the world are using table salt, and table salt is a refined form. It has only sodium chloride. It has nothing else in it. And this sodium chloride leads to water retention. The sodium leads to water retention, tissue edema, and of course poor circulation. And when the body tries to take care of this, a lot of other things happen, like gall and kidney stones. Along with this, another very important issue takes place, that because of this sodium being high, the other trace elements like potassium, calcium, magnesium, copper, zinc, manganese, their function also gets deranged and they go out of balance. And all the processed foods which we eat, all of them contain this type of salt, and therefore this becomes a very important contributory factor for the development of hypertension. Now, natural salt is what we recommend. And natural salt, because it is coming from the earth, and as you know, our body is made up of the 5 elements. So when you take natural salt, all the 5 elements you are imbibing, because of which it is safer to use these. In fact, salt has been so important that during the Roman times, the Roman Empire used to pay their soldiers and a lot of other people in salt. So therefore, it is also called white gold. It is that important. So a proper type of salt is important for us. What we generally recommend is pink Himalayan salt, which has all of these. Then yet another very important aspect, which I would like to discuss in a little detail, is the accumulation of heavy metals in the body, which can cause havoc leading to hypertension and other diseases. I would like to tell you why this is important. Now, I know that a lot of formulations contain heavy metals because the time when Ayurveda and many other of the ancient sciences developed, at that time we did not have high levels of heavy metals in our body. So we could take recourse to that. But now the time has changed. We are imbibing a lot of heavy metals, and I'll tell you one by one what they are doing to us. Now, if there's excess of lead in the body, which is very common because we are testing in our clinics and we find that lead is high in most of the people. So if a person has hypertension, we should also suspect lead being high in the body, in the tissues. So lead interferes with nitric oxide availability, and increases renin and angiotensin production. It also interferes with the action of calcium, and to the cells, this lead looks similar to magnesium and potassium. We know that magnesium and potassium are important for blood pressure regulation. So, since the cell mistake it for that, the action of magnesium and potassium gets reduced, which further leads to the development of hypertension. Similarly, inflammatory markers like HSCRP gets elevated because of lead in the body. So if you see a person having a high HSCRP level, you should suspect lead toxicity or high levels of lead in the body. Elevated lead is associated with a higher amount of homocysteine also in the body, because it interferes with the metabolism of this in the body. And when you have high homocysteine levels, it contributes to cardiovascular problems also. And we have found now that lead is also found to be pretty high in people who have Alzheimer's disease or Parkinson's disease. So it harms the neurological system as well. The other heavy metals are mercury, cadmium, and many others. Now, when you have more of mercury and cadmium, let me tell you, because of excessive smoking, because of exhaust pollution, because of paints and all that, the cadmium level is increasing in the body. And because of that, we are having hypertension. Similarly, mercury is increasing, one from the soil, and secondly from the fish, and third and most important, because of the dental amalgams which are being put for filling in by our colleagues in dentistry. They do not realize it, but mercury we are inhaling, these mercury vapors we are inhaling continuously if we have a filling in our mouths. And what they do is, these two heavy metals, they interfere with the degradation of catecholamines, because of which there's an increase in urinary epinephrine, norepinephrine, and dopamine. All of these three we know contribute to the development of hypertension. And cadmium is a vasoconstrictor and inhibits vasodilator nitric oxide. So if there's more cadmium in the body, nitric oxide production gets hampered, and this leads to hampering of the arterial wall. Also, at the same time, it depletes glutathione in the body. Glutathione is a very important, very potent antioxidant. And arsenic interferes with the ability of blood vessels to dilate and constrict as it is supposed to do. So here again we have these issues. So if anyone has all of these heavy metals in them, that could be an important factor for the development of hypertension. But now coming to the main cause, now whatever I've discussed so far, all of these factors are contributing to the development of insulin resistance, which we call metabolic syndrome. So the basic reason at the root cause is insulin resistance, which contributes to not only hypertension, but to all other conditions like diabetes, pre-diabetes, joint problems, PCOD. There are so many of them. Now, what is this insulin resistance? It basically occurs as the body tries to maintain homeostasis. Now, this causes high insulin levels, and the greater the resistance, the greater the insulin levels in the body. Then what happens is that I'll try to explain this. Whenever we eat, then the body produces insulin. The purpose of insulin is to extract energy in the form of glucose from the food, predominantly carbohydrates and starches, and transfer it into the cells for metabolic activity. The cells which we have in our body have a very limited capacity, but we eat more frequently, we eat much more generally, because of which a lot of insulin gets produced, a lot of glucose is produced, and this insulin tries to push it into the cells. But the cells, having a limited capacity, resist it. This, in essence, is what insulin resistance is. So when this happens, a lot of glucose remains in the body. And this glucose, two things happen to it. One, a lot of glucose flows through the blood vessels, and the blood vessels have not been used to this high level of glucose, so the endothelium gets damaged, because of which hypertension and many other diseases occur. That is one reason. Second is, the insulin has a secondary purpose also, and that is to convert this extra glucose into fat. And this extra fat then gets accumulated in the body, in the liver, in the kidneys, in the heart, and so many other organs. And this is inflammatory fat, which further contributes to hypertension and many other conditions. So this is the root cause, and this is what needs to be addressed. Now, if you focus on this slide, you can see that on the left side, you find a lot of people waiting at the platform. And this symbolizes excess glucose in the body. Then you see the coach. The carriage is absolutely full, jam packed. And the security guards are trying to push people into the coach. This signifies insulin. So, this is what is happening. The compartment is already full. There's excess of insulin, excess of glucose. So, this insulin is trying to push it in, but it is not happening. So, this is how you can understand what insulin resistance is. Similarly, here the suitcase is already full, and this lady is sitting on the suitcase to be able to, shove in some more clothes. This is exactly what is happening to us in our bodies. Now, how does this cause hypertension? This obviously is a very important question. One, as I mentioned, because the excess glucose is flowing in the blood vessels, so it damages the endothelium, and the damaged endothelium leads to hypertension. Second, a lot of free molecules of glucose attach to proteins in the body, and new products are formed called AGEs, or advanced glycosylated end products, which stick to the blood vessels, damage them, and start atherosclerosis. And then they get into the small arteries and capillaries, block them, and accumulate as amyloid. When they accumulate in the capillary bed of the kidneys, they lead to hypertension. Excess glucose causes a lot of deficiency of magnesium. Chronic magnesium deficiency occurs. Now, to give you an example, when we eat, table sugar, for 2 molecules of table sugar for them to be metabolized, 56 molecules of magnesium are required. And this magnesium, the body is extracted from the body, which means we get deficient in magnesium, about which I've already mentioned. Now, what leads to insulin resistance? Now, there's a big list of conditions which lead to that. We know all processed foods, all refined foods, packaged, unnatural foods, drinks, soft drinks, grain, predominantly wheat, anything causing destruction of healthy gut microbes, antibiotics, corticosteroids, unnatural habits, staying away from nature, are disturbed circadian rhythm. This is a very important aspect, and circadian rhythm we sort of have forgotten it, though Ayurveda has been talking about this for the past 5,000 years. It is only recently that mainstream medicine is waking up to it, and that too, thankfully, because of a couple of books which have just come out very recently on the circadian cycle. And I think 90% of us are not in sync with the circadian cycle. This is a very important cause for hypertension or insulin resistance to develop. Then inadequate or disturbed sleep is a very important factor. Again, it stems from the same circadian cycle being disturbed. Deficiencies of vitamins and minerals, accumulation of toxins, as I mentioned, heavy metals, lack of exercise, and of course, stress. Just a little word on magnesium and hypertension. Magnesium deficiency knocks the rest of the minerals out of balance, like potassium, manganese, copper, zinc, molybdenum, iron, etc. And this magnesium deficiency also causes endothelial dysfunction, which further contributes to development of hypertension. Now, then this, of course, you know that when there's more of insulin in the body, a lot of other things happen. So if this inflammation leads to atherosclerosis, cardiovascular disease, and hypertension, we know that. Endothelium, of course, we know that this is the lining of the inner lining of the blood vessels, and this, of course, has many functions. All blood vessels of the body, including the heart, are covered with a thin layer, and the function is it controls blood coagulation, the tone of the blood vessels of the heart as well as the entire body. And it is the largest endocrine gland. It produces hormones, regulates our blood pressure, blood sugar, electrolytes, immune system, and it is also important for preventing inflammation. So when this gets damaged, then hypertension results. Now, how do we diagnose hypertension? Now, we all know that to diagnose it, the best thing to do is to keep checking the blood pressure regularly. That gives us a good idea. Otherwise, it is diagnosed by a complication having taken place, like blindness, heart attack, kidney failure, strokes, dementia. Obviously, we don't have to wait for that to happen. Now, how do we manage? In this context, I would just like to mention that there's also a question mark regarding the management, regarding the checking of the blood pressure, because there are factors like white coat hypertension, in which a person does not actually have hypertension, but when he comes to the clinic and the blood pressure is checked, because of stress, the blood pressure reading is found to be high. Similarly, there could be a situation that a person in the clinic may have a normal blood pressure at being checked, but in reality he has a high blood pressure which is checked at home. And thirdly, there could be nocturnal hypertension, which will not get detected by these usual methods. So these are pitfalls in the method of checking blood pressure. Now, very lately, newer techniques have come up. For example, people wearing Apple watches and all that. So many of these technology companies, they're coming up with a lot of apps for checking blood pressure. But uh, this, of course, has a great future. But at this point of time, the blood pressure reading done by these methods is not very accurate. But it is bound to improve in due course of time. It is said 1/4 of what you eat keeps you alive. The other 3/4 keeps your doctor alive. This is quite true, I think. So when should you use drugs to treat hypertension? I'm quoting a Dr. Asim Malhotra here, who's written a very nice book called A Statin-Free Life. It got published only in the month of March this year. And according to him, the only real benefit from taking drugs to reduce blood pressure occurs once blood pressure goes above 160 by 100 millimeters of mercury. Systemic reviews of the evidence revealed that treating mildly raised blood pressure that is lower than this with medication does not reduce heart attacks, stroke, or deaths. You may ask why that is the case. It's likely because blood pressure pills don't treat the root cause, which is insulin resistance. So when we are giving blood pressure medications, we are only reducing the numbers, but we are not correcting the main cause, and that is insulin resistance, which is why they are not very effective. So management comprises of any all of these. Of course, one is diet, the other is exercise, yoga, qigong, naturopathy, and of course relaxation. Then of course Ayurveda would be another important one to do. Now the diet which you suggest, it is suggested that if you take this type of a diet, then reversal of hypertension may take place in as less as 2 weeks. So what is recommended is eat more of fruits, fresh vegetables, seasonal vegetables, onions, radish, cucumber, garlic, cabbage. Very sweet foods should be avoided because they may increase fatty liver, and the accumulation of fat in the liver. Use of nuts and seeds, omega 3s. Now this omega 3 I want to tell you a little bit about. Omega 3 fatty acids are very important. Unfortunately, the ratio between omega 3 and omega 6 has got completely reversed. Most of our diet comprises of omega 6s and very little omega 3. And of the omega 3s also, what is the most important is omega 3 derived from fish sources. Now, this can become a big issue because most fish, excepting for deep ocean fish, contain a lot of mercury. So there's a big question mark regarding use of omega 3 from fish. Now, fish actually feed on algae in the seabed. So very lately, companies have started coming out with omega 3 derived from algae, which may be better because that there may not be that much of mercury in them. And secondly, this would be all right for vegetarians also. So omega 3 is a very important thing in the management of hypertension. It is also anti-inflammatory and helps in the reduction of insulin resistance. You have to cut back on foods like high in saturated trans fats, limit sodium intake, sweets, sugary or colored flavored drinks. These, of course, I think everybody knows, but they are important. Now, green vegetables have a very important role to play in reducing blood pressure, especially things like arugula, which unfortunately we don't get here. Lettuce we have, rhubarb, I don't know whether it is available in India, beets, pine nuts, kale, bok choy, are very important, palak, fennel are all rich in nitrates. So when these are eaten, enzymes and bacteria in the mouth, especially in the crevices of the tongue, convert these nitrates into nitrite, as I mentioned before. This nitrate gets to the stomach, and the acid reduces this to nitric oxide, which helps in the helps in arterial relaxation, and therefore reduces blood pressure. Now, researchers at Queen Mary University Hospital found that those who consumed a nitrate-rich meal A bowl of lettuce experienced an 11.2 millimeter drop in mercury and blood pressure within just a few hours. A reduction is lasted the whole day long. So this is how important they are. Then how does potassium help? It relaxes the walls of the blood vessels and also drops the blood pressure by balancing the negative effects of common salt. And potassium we have in a lot of things. For example, again, leafy green vegetables, arugula, lettuce, salad, turnip greens, shaljam, and all that, which we are all aware of. Indian gooseberry, of course, is very important. A very important thing for reducing hypertension. Lime or lemon a number of times a day can be taken. Watermelons also have a role to play. Papaya is good for hypertension. Berries. Now, berries like blueberries, they're rich in natural flavonoids, prevent hypertension, low blood pressure. Blueberries, raspberries, strawberries, red beets, and garlic. Now, garlic is something I just want to mention a little about because there are a lot of misconceptions regarding garlic. One is that when garlic is to be given, best is to take it raw, and when you are going to take it raw, it is now believed that it should be crushed rather than cut, because when you crush it, then it is at that point of time that curcumin gets released, and that is what helps in the help of, in helping garlic. Secondly, the other important factor is that garlic, if it is heated, it loses efficacy to a large extent. So the recommended thing is that if you want to add garlic to your vegetables or whatever you want to add it in, let the vegetable be cooked, and just after it has been cooked, when it is about to cool down, then you can add the garlic. Then it retains its efficacy. And garlic is rich in nitric oxide, and therefore it is very helpful. Similarly, seeds of sunflower and pumpkin, they are important for controlling blood pressure also. There are other foods also like mint leaf paste. Half a cup of Loki juice is supposed to be helpful. Potatoes, raw potatoes are helpful in this. Dark chocolates, pistachios, pomegranates have assumed a very important role for management of hypertension. Now, salt reduction. Now, this is something everybody keeps talking about. We know about that. And in this, I would like to say that if you consume pink Himalayan salt, then too much of restriction may not be required because this does not contain that much of sodium. And if you resort to the other natural methods of reversing hypertension, which will happen if intermittent fasting is used and insulin resistance is managed with the proper diet, which is advised. So, if you do that, then you do not need to reduce salt considerably. I'll discuss this a little later. Intake of healthy fats like ghee or clarified butter, cold pressed mustard and coconut oil, MCT oil, extra virgin olive oil. These are very good for for hypertension. Adequate hydration is a very important aspect for managing hypertension, and there's a formula for this. In general, you should try to drink between half an ounce to an ounce of water for every pound you weigh every day. Of course, there have to be certain exceptions. If a person has cardiac failure or they already have a lot of accumulation of fluid in the body, then you have to tone it down. If they have renal dysfunction, this formula would certainly not apply. Now, since insulin resistance and inflammation play such important roles, reducing or eliminating both is of paramount importance. So, basically, this is the mainstay of treatment of hypertension. Now, what I normally do is when a patient comes to me, if they've been taking antihypertensives, I do not stop them. I put them on this intermittent fasting and management of insulin resistance by a proper diet and all that. And gradually, I reduce the antihypertensive because this process kicks in, the blood pressure starts coming down, and that's the time when you can reduce the medication slowly. This, of course, entails proper instructions to the patient also. You have to give a proper diet. You eliminate all inflammatory foods and increase the natural ones. Intermittent fasting already mentioned. Detoxification. This is a very important aspect of managing any chronic disease because toxins are contributing to all diseases, insulin resistance included. So I already mentioned how heavy metals in excess are leading to these type of problems. you need to give some nutritional supplement, because many patients are deficient in things like magnesium. They could be deficient in potassium. They could be deficient in many other things like alpha lipoic acid and other things. Then exercise, of course, plays a very important role. Mind body techniques are important, and detoxification has three basic ways it can be done. You detoxify the body through therapies, and mind you detoxify through the breath, the pranayama and all that, and spirit by meditation. This slide has got a little change for some reason. Now, the very first thing to do is to avoid imbibing toxins and to remove or reduce our exposure to chemicals, plastics, pesticides, pollution, and all artificial things which are toxic to us. What I recommend to my patients is that they should walk through mentally from morning till evening what they are doing at home, what they consume in the morning, how the food is cooked, what oils they're using in the cooking, what they're using as preservatives, what they're using as packaging material, what toothpaste they are using, what toothbrush they are using, whether they are doing oil pulling or not. All of these need to be discussed and explained to them. For each one of them is very important. If you do a proper detoxification alone, that itself is sufficient in taking away most of the problems. Then, to give you an example, now sodium lauryl sulfate is present in almost all toothpastes, soaps, shampoos, shaving soaps, tobacco, and then of course tobacco, alcohol. So in place of sodium lauryl sulfate, use chemical-free toiletries which are available online. There are many companies which are manufacturing them. So switch over to all that. Similarly, stop using plastic in any form. No plastic containers, bottles, buckets, tumblers, even combs. I use a wooden comb. I've stopped using plastic combs for a long time. Use glass or wood wherever possible, because these two are inert and they are helpful. Similarly, aluminum utensils, foils, deodorants, perfumes, drugs. Use only natural stuff in place of these. And there are many methods of detoxification. Many of them can be done at home. One need not spend too much of money on that. Oil pulling is a very, very important aspect of detoxification. I recommend it to every patient, whether they have a dental issue or they don't have it, because oil pulling not only takes care of the oral microbiome, but also detoxifies the rest of the body. And the method is simple. I think everybody would be aware of that. What I tell them is to take 1.5 to maybe two tablespoonfuls of cold pressed coconut oil and keep swishing it in their mouth when they get up in the morning for about 15 or 20 minutes. But a word of caution here: when you are using this, when you are using oil pulling, one, you should never swallow it, and number two, do not spit it in the bathroom sink, because this may, if the weather gets cold, it may block the sink completely. So what is recommended is that you should spit it either on grass or sand, or there's another alternative. You can use a flower pot, fill it up with sand, and then spit in that. This is important. And after you've done this, then it is best to swish your mouth with warm saline. That is, take warm water, add a little salt to it, pink Himalayan salt, and rinse your mouth with that. That is important. Then dry brushing is important. Dry brushes are easily available. Brush your body thoroughly before having a shower. Massage yourself, and then of course use a far infrared sauna, steam baths. Mud packs are very effective. Colon hydrotherapy I mentioned here, but it needs to be done with a lot of precaution. So there has to be a proper teaching about this, but should not be done without understanding the theory behind it. Then chelation. Now, up till now, we were using IV chelations of calcium EDTA, but now oral ones are also available, and they're pretty effective. Then, of course, Shirodhara and all that can be used. The keto diet and intermittent fasting are the mainstay of treatment. I advise them an early dinner, say around 7:30 p.m. Then a late breakfast or lunch at 11:30. In between, they can have water, lime water, black tea or coffee, green tea, aloe vera juice, vegetable juices. In between, they can have, but nothing else. At lunch, they should have a lot of vegetables as smoothies. Veggies can be steamed, they could be raw, like salads, cooked. And the rotis, there should be no wheat in the rotis. You can have millets, but not wheat. You can have ghee, you can have some dal. Nuts, green smoothies, paneer, salads can be had at 4 to 5 p.m. and an early dinner again. Now, avoid alcohol and tobacco in any form. Weight reduction generally is very significant along with this. And diabetics, of course, need to avoid sugary foods as well. Now, then, of course, stress management takes precedence in practically every disease. Even if you do not have a disease, you must manage your stress because stress levels are going up and up and up. We are exposed to much more stress than perhaps our parents were. Exercise, we know, all of us know how important it is. Yoga, again, we know the importance of yoga. Yoga has effect on both our physical body, our mental body, our mind, our spiritual body, everything. And of course, there have been some studies like I'm quoting Dr. Joel Kahn in his book, The Whole Heart Solution. He mentioned about 50 patients with high blood pressure who participated in a yoga practice for 15 days, lasting 2 hours each sessions. Cardiac function was assessed before and after this training. After practicing yoga for 2 weeks, patients experienced significantly reduced resting heart rates and systolic and diastolic blood pressure. A comparison group that did not do the training did not experience these benefits. So you know that we have proof of this. There are very typical asanas which are prescribed for hypertension. I will not go into details about that. Pranayama is very important, especially the cooling pranayams like Chandrabhedi pranayam. You can do Gehre Lambe Saans, the diaphragmatic breathing, and Shitli or Shitkari pranayam. They are very effective for reducing blood pressure. Then diaphragmatic breathing, I already mentioned. There's a modification of the diaphragmatic breathing called 478 breathing, which also is very effective. Anulom Vilom, we all know, is good for hypertension. Brahmari pranayam is very good because it increases nitric oxide production. So this pranayam is known, scientifically proved, to increase production of nitric oxide in the blood vessels, because of which it has a direct effect on the blood vessels, blood pressure reduces, and along with that, it is very good for meditation also and has a lot of meditative effects. Yog Nidra is an excellent method of for hypertension, or for that matter, any mental problem, heart disease, anything. Everybody should practice Yog Nidra. Qigong is one more thing in our armamentarium for managing hypertension. This has been scientifically proved to be effective for hypertension. It has multiple benefits. Then vagal stimulation by face yoga. This looks a little funny, but you know that the vagus nerve is the largest nerve in the body. It starts from the medulla oblongata, goes right down to the rectum, gives branches to the entire systems and organs in between these structures. And therefore, and also we know the vagus nerve has a bidirectional flow, and this is important for parasympathetic functions of our body. So if this tone can be increased, and one of the good methods is doing face yoga, then the parasympathetic system gets stimulated, because of which one starts relaxing and the blood pressure starts coming down. Kapol Vikasa Kriya has been described in yoga. There's a typical method of doing it. This is actually part of face yoga, and this is also very effective. Visualization techniques are very effective. I try to advise it to all the patients who wish to learn it, and I found patient blood pressure getting regulated. There are some scientific studies also. For example, Dr. Alvaro Pascal Leon, who was a professor of neurology at Harvard Medical School, in 2005, he did a study. He took two groups of students. They were taught playing the piano. One group used real pianos, while the other practiced only in their minds. After 6 hours of practice over 3 days, the two groups had similar changes in their brain maps and similar improvements in actual performance. So this is how effective it is. There are many other scientific studies. Then nature, Albert Einstein said, look deep into nature, then you will understand everything better. And I've just added a little bit to that if you look beyond nature, you can actually go to the truth also. Natural methods like hydrotherapy, mud therapy, partial or full body massage, fresh air, laughter therapy. We see yoga practitioners laughing their guts out. This is a very effective method, because I think many of you may be aware that when you say ha, this tends to stimulate different parts of your body, and one of them, of course, is relaxation. So it is said a good laugh and a long sleep are the two best cures for anything. Meditation, we know very well how effective and important it is. There have been scientific studies to prove it. I won't go into details about that. There's some more scientific study here which have proved it. Shirodhara, of course, is pure Ayurveda. This is extremely effective and extremely good for hypertension. So, to conclude, diet and intermittent fasting must be done. Be careful about your salt intake and the food you eat. Quit smoking. A good, adequate, and relaxing sleep is very important. Stay in alignment with nature and in balance with the circadian rhythm. Positive visualization. Stay relaxed and happy. Do yoga, meditation, qigong, yoga nidra, and of course, last but not the least, keep smiling. Thank you very much.
Well, Dr. Kohli, thank you so much for the very in-depth insights about managing the hypertension, such a challenging condition, and also integrating the various aspects not only of the modern medicine, but also about meditation, laugh, Ayurveda for that matter, right? So that I hope all the doctors that have joined us would certainly have been enlightened and be much more, kind of understanding about the entire gamut of uh, the 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 kind of problems. So, Dr. Kohli, thank you so much. And as you said, that we need to keep more smiling. So I'll try to smile more. Yeah, and joining us is the senior GM marketing at our Dr. DP sir. And I will request Dr. DP sir to please throw some insights about the management of the challenging condition like this from the Ayurveda perspective. Over to you, DP sir.
Yeah, thank you, Anuj. Thank you very much, Kohli sir. Thank you, sir. Uh,
You're welcome.
so it's nice to see you, sir, after a long time. Yes, we had a long gap
Yes,
in between.
very, very long time. Yes.
Yeah. But having said that, Anuj, in fact, there is nothing much left to speak about the management because Dr. Kohli sir had given the entire holistic management, whether the diet or the lifestyle and the yoga therapy, meditation, everything, including the medications, whatever. Because as I believe, these days, as Kohli sir also told, these days hypertension is one of the very common cause. Uh, B, maybe it is the work, maybe the pressures at the work level, at the personal level, at the professional level, because the stress triggers or multiple triggers are there. Earlier, maybe if we speak of maybe 5 to 7 years back, there were not much stress triggers are there, but these days everything is a stress. अगर बच्चों का एडमिशन मिला तो स्ट्रेस, नहीं मिला तो स्ट्रेस, घर खरीदा स्ट्रेस, घर घर नहीं मिल रहा स्ट्रेस, रेंट को घर नहीं मिल रहा वो भी एक स्ट्रेस है. So apart from this, there are multiple factors at the work and the professional personal level. So every time we are under continuous stress, and if the stress is not maintained properly, managed properly by proper relaxation, proper meditation, or the various ways what Dr. Kohli has told, uh, we unknowingly go into the hypertensive mode. हमको नहीं पता हम लोग हाइपरटेंशन में जा रहा है, बट ओवर अ पीरियड ऑफ टाइम सडनली हमको पता चलता है, अरे मेरा हाइपरटेंशन बढ़ा हुआ है, मुझे ज्यादा नींद नहीं आ रही है, या मुझे पसीना ज्यादा आ रहा है, मुझे आजकल थकावट ज्यादा आ रही है. सो देन वी रियलाइज मुझे हाइपरटेंशन हो गया. सो अननोइंगली वी आर फॉलिंग इनटू द ट्रैप ऑफ द हाइपरटेंशन. So my point is, before going into the trap, if we start adopting the technologies or the techniques what Ayurveda already mentioned, which were reiterated by Kohli sir, that yoga is there, diet is one of the most common things, because even in Ayurveda, as most of the doctors attending here know, that we have Ahar, Nidra, Brahmacharya. These are the three main pillars of the health. So if you see the chikitsa comes much later part. Aushadhi comes much later part. But Ahar, Nidra, Brahmacharya, these are the main pillars to maintain the proper health. So Ahar के बारे में सब लोग ने already they have given most of the insights. Similarly, we should have proper sleep. I'll tell you, मतलब there I have seen many people who have compromised their sleep habit because of various priorities, and then got into the serious sickness, because as we believe that a minimum 6 to 8 hours sleep is required for a proper health, but many times we compromise because of various priorities. We compromise on our lifestyle, and we compromise our sleep habits, reduce the sleep. We go to sleep at maybe at 1 o'clock and again wake up at 5 o'clock because of various priorities. So we are compromising on the sleep habits, and because of the lack of sleep, it is indirectly hampering the health. आज तो हमको अच्छा लगेगा, मैं तो लेट नाइट किया, वर्कआउट किया, मैं तो एम्प्लॉय हूँ, मैं तो एग्जीक्यूटिव, मैं तो रात को बैठता हूँ, बट दैट over a longer period of time, that will be have a severe habit health hazards on the health. So that's the reason sleep is one of the very important factors. Similarly, brahmacharya, the healthy lifestyle is one thing which is more required. Ahar nidra brahmacharya. Then even if we see the chikitsa, the part, ahar vihar aushadhi. So in most of the lifestyle conditions, aushadhi comes as a much later part. First is your ahar, what diet we are taking, whether it's a nutritious diet or it's a all the fried food or the salty food, etc. Or then ahar vihar, then what is the lifestyle we are adopting, whether we are going for the walk or the yoga or the exercise or the meditation, etc. Then comes aushadhi. So if we consider our ahar and vihar and nidra, I think most of the our lifestyle problems get solved. We need not resort to the medication part. Medication comes much later stage. So if we speak of Ayurveda in the hypertension in Ayurveda, it's a very clear cut example. I see hypertension as a not a in fact not I see I didn't remember, maybe I'm not wrong. The Ayurveda doctors present in the forum might give a comment. We haven't seen hypertension as a disease. It is one of the underlying cause. It is one of the underlying symptom which can impact many other diseases. Hypertension, if not treated, might affect the brain, might affect kidney, might affect the heart, might affect other vital organs, the three marmas which were told in Ayurveda. It will affect those three marmas. But hypertension as such is not as a disease. Because if we see hypertension, the pathology, we learn that there is a pranavaha srotas, rasavaha srotas, raktavaha srotas. So this is the involvement of pranavaha, the movement of the air passages, rasavaha and raktavaha, the blood circulation. All these srotas are involved with raktadhatu. So there's if you see the Ayurveda pathology, so there is a srotas, there is a dhatu, and we say in Ayurveda all the movements, all the kinetic movements in the body are governed by vata, and all lubrication or all the supportive system in the body are maintained by kapha, and all metabolic functions are governed by pitta. If we classify broadly these kinetic movements, metabolic functions, and the lubrication the supportive system, hypertension is one such symptom which is involving all these three factors: vata, pitta, and kapha. Because vata is movement. In hypertension, what is happening? The blood flow, which has to flow, is hampering, is stopping, is creating a pressure on the walls of the arterial pressure, which is called the hypertension. Because the walls are creating more pressure, the blood is unable to flow through those arteries because of the pressure. That pressure might occur because of the excessive kapha. There is excessive like triglycerides or the cholesterol or any blocks. Something is happening. So there is a obstruction, srota avarodha, which we call in Ayurveda. There is a avarodha for the blood flow, because of which blood is pumping more forcefully towards that artery, which is causing the pressure. Now, if we see this as our nidan or etiology in Ayurveda, we can easily find out the ways how to release the pressure, either by diet or by something other matters or by medicine, etc. Of course, आहार के बारे में, डाइट के बारे में डॉक्टर कोहली जी ने बहुत कुछ बता दिया. सर, I would like to just add 2-3 points, maybe thing. Very recently, I come across an article that beetroot contains a high amount of nitrates. So consumption of beet,
I
yeah.
mentioned that in the slide, yes.
Okay, right, so correct, sir. So beetroot juice or the beetroot consumption contains high amount of nitrates, so that's very good for the heart health. So similarly, sir, maybe I read in one of the articles, banana is a very rich source of potassium,
Yes.
which reduces the levels of sodium disadvantages. But
Right.
I don't know whether banana can be taken by the diabetics or not. There are many controversial theories. Some dietitians say it can be taken, some dietitians says it cannot be taken. So I don't go into that controversy. But having said that, for the non-diabetics, banana is one of the very good source of potassium,
Right.
which is very good for the heart health. Grapes, already sir told, berries, sir also already told. Grapes also contains very rich amount of potassium. So
Yes.
the black grapes, मुनक्का जो हम लोग बोलते हैं, तो daily early morning taking munakka. There are many people in India, they take early morning with a coffee or milk some dry fruits like दो तीन बादाम, दो तीन काजू, दो तीन मुनक्का लेते हैं. But that munakka contains rich amount of potassium and which improves the cardiac muscle health, so that the pumping of the systolic and diastolic pressures, which Dr. Police have told, the cardiac muscle pumping will be helped by these black grapes, munakka types. So they are very helpful in that. Well, when it comes to the medication, of course, many doctors will be knowing. One common medicine which I would like to reiterate here through Indian Vaidyas is we have a very simple medicine called Prabhakar Vati, because Prabhakar Vati is very good for the tachycardia, where there is a irregular heartbeat is there and high beats are there. In those conditions, Prabhakar Vati, if you see the Ayurvedic literature, it is indicated in the Vataja Hridroga. So Vata Hridraga, again I am taking back, because in hypertension, Vata is mainly affected by Avarodha of or Avarana of Kapha. So Vata is Avarana by the surrounded by Kapha. So Vata movement is obstructed here. So to treat that, one simple medicine which we have tried in many patients, simple Prabhakar Vati, 2 tablets, 2 times a day, is able to control the blood pressure. While I'm mentioning diet and ahar and vihar are essential, but if at all some medicine is to given, we can rely on Prabhakar Vati, a very good medicine in Ayurveda, which is very good in Ayurveda. Plus, we have in proprietary medicines, we have very good medicine called Lipistat, which contains the Pushkarmool, Gugulu, and Arjuna. As everyone knows, Arjuna improves the cardiac health. It improves the cardiac pumping. While Gugulu, everyone knows, is the anti-hypercholesteremic weight reducing में काम आता है and good for the good health. Pushkar Mool is a cardiac tonic, so it contains the all three in equal proportions and is very good cardiac tonic. So in hypertension, again coming back, my line of treatment is the heart, how to improve the heart health or the circulatory health, not going exactly onto the hypertension. We should try to improve the cardiac health, heart health, arterial health, how to restore the circulatory system basically. So if the circulatory system is restored, then I think we can attain the goal of managing the hypertension. Again, hypertension can be managed. It can be controlled for certain time, but if the person is going back to the irregular food habits or irregular diet habits, again it might relapse. So one must ensure that this is a continuous phenomena. That's all about. I would like to add what Dr. Police have told. So Lipistat we have sir, for the benefit of doctors. I would like to mention here, we have recently launched a product called Hridaya Asav. So Hridaya Asav is we have in Ayurveda we have a preparation called Arjuna Rishta. Arjuna is a key ingredient with which Arjuna Rishta is prepared. So we have added Arjuna Rishta with Brahmi, Shankapushpi, Guduchi like ingredients. So as I told you in the beginning, most of the hypertension patients are restless. They don't get a proper sleep, or tenseness, tiredness, anxiety बहुत ज़्यादा होती है. तो इसलिए हमने क्या किया था, अर्जुना रिश्ते के साथ कुछ शंखपुष्पी, ब्राह्मी जैसे एंग्जियोलाइटिक इंग्रेडिएंट्स हमने ऐड किया था, so that it gives a holistic benefit for the heart health. So Hridaya we have done, and fortunately most of the doctors have given a very positive feedback on Hridaya. 2 spoons 2 times a day is a normal recommendation. So this is the one product which I would recommend most of the doctors, all the doctors, to start to try on the product. And lastly, of course, everyone knows we have a very good product, promising product, Ashwagandha Stresscom capsule, which by name itself reduces the stress, reduces the cortisol levels, and reduces stress and maintains the hypertension. There are many theories about Ayurveda in Ashwagandha. Ashwagandha because it reduces Vata Kapha and increases Pitta. So by increasing Pitta, many people perceive that it might increase the hypertension. But no, we have done lot of clinical trials. and all the trials indicated that ashwagandha doesn't increase hypertension. It manages the vata and pitta. It manages vata and kapha and regulates the pitta and regulates the hypertension. It doesn't increase the hypertension. It regulates the hypertension. So that's about the research which we have done on the Stresscom. So Stresscom, Lipistat, Hridayasva, Prabhakarvati. So these are the 4 products which I can suggest on behalf of Dabur to try, apart from Ahara and Vihara. So over to Anuj. Thank you for giving me time. Sir, I would like to just ask before actually the question answers come. One more question which keeps hampering me, which keeps interesting me. So I heard many times that the range of hypertension varies with the age and the height. Is it true? Because I believe 120 by 80 is the only figure. Everyone read 120 by 80, but it's very hard to maintain the 120 by 80 number. Some people get 140 by 80 or 140 by 90, and many doctors says नहीं आपका एज के लिए ये भी ठीक है, but एज के साथ ऐसे चेंज होता है क्या?
Well, there used to be a formula for that, but we don't really go on that. We still take 120/80 to be the standard. But as I mentioned in one of the slides, that if the pressure goes beyond 140, 150, there's a benefit in treating hypertension only when the systolic is more than 160 and diastolic more than 90. Otherwise, there are no benefits of doing that. And even if there's marginally higher pressure, you can just change the diet. And I often give patient magnesium.
Okay.
Practically all are deficient in that, and the moment you give magnesium, this starts coming down. Plus, magnesium has other advantages also. For example, it relaxes the body, it gives you a good sleep, it, of course, improves the deficiency, corrects the blood pressure. So, magnesium is a very good substitute which can be given by anybody. So, if you find it is beyond 140 or 140/90 or something like that, 150/90 or something like that, you can give that. But magnesium can be given at any level of hypertension.
Okay.
Similarly, I think homeopathy also has some products like that, Magforce or something like that. I'm not very familiar with that, but magnesium salt in some form is very effective. And I normally, if they have borderline hypertension, I of course advise them diet and all that, but I tell them to take magnesium and ashwagandha, and that's take care of everything for them.
Thanks, sir. Thanks. Yeah, Anuj, over to you.
Okay. Sir, thank you so much. I'm just sharing the slides. Dr. Durga Prasad, sir, thank you so much for throwing a deep insight into the management of such a challenging condition, hypertension. And from the Ayurveda perspective, you have already mentioned, sir, majority of the solutions that we have from the Dabur India Limited for managing such a problematic condition. Before I get into the products, I'll request the doctors that are there with us to kindly mention the questions in the chat box so that Dr. Kohli and Dr. DP can answer that. And subsequently, after this, we will open the session for the question answer session. So some of the key brands that we have for managing, as Dr. DP rightly said, it is not the hypertension but the underlying conditions which leads up to hypertension that are very critical, right? So in that context, we have one of the very good products, very efficacious, very helpful product in the name of Stresscom, which is pure ashwagandha, a high quality ashwagandha, and serum cortisol is significantly reduced by using Stresscom, and the immunomodulatory action of Stresscom, rather, it kind of helps protect from the infections, and also the lymphocytes and phagocytes, which kind of are for the infections, that also is kind of stimulated. The premature aging symptoms because of stress, when Dr. Kohli also mentioned that because of stress, it kind of deteriorates the kind of metabolic functions of a person, right? And that kind of shows up into the premature aging of a person. Stresscom helps to delay that and kind of arrest that. And we all know very well that ashwagandha has adaptogenic, antioxidant, and anti-anxiolytic properties and anti-inflammatory properties. So Stresscom is a unique product. Why? Because the manufacturing process of what you call Stresscom is very unique. It is a lipid-based unique formulation. Why we have used a lipid-based formulation is to ensure better availability and also better absorption of the ashwagandha. So it contains root extract of ashwagandha, which is Videnia somniferia, 300 mg, and each capsule is equivalent, if you look at, is 6 gram of ashwagandha churna. And dosage, 1 capsule twice a day, preferably with milk. Some of the indications that we can use Stresscom is physical and mental stress, chronic fatigue syndrome, insomnia associated with stress. So the underlying term that we can hear again and again is the stress, which is kind of precursor to some of the challenging problems, general weakness, and the immunity, low immunity. So Stresscom is one. Dr. DP also mentioned about this product, Hridayasava, which is very useful in the conditions of the heart. And शुद्धता ही हमारी पहचान, सुरक्षित एवं गुणवत्ता युक्त आसव आसावरिष्ठ. तो ये एक ऐसा प्रिपरेशन है, डॉक्टर साहब ने पहले ही हाईलाइट किया है सर, कोहली सर, कि इसमें हमने जो है हार्ट के लिए जो जो चाहिए बेनिफिशियल चीजें, वो सारी चीजें हैं. जैसे अर्जुन है, पुष्कर मूल है, अश्वगंधा है, which is very very useful, mentioned in Ayurveda text as for the cardiac problems. We also need a rasayana to enhance the functioning of the heart, primarily because if the circulatory system, as mentioned by Dr. DP also, that if the circulatory system is very very good, it will take care of the other problems. So it also should have rasayana, and typically the king of rasayana in Ayurveda is amla. We have ashwagandha also, guduchi, draksha, we have mentioned that, grapes, right? Balya, to give the strength to the cardiac muscles, right? The cardiac muscles should have the strength to kind of withstand the flow and the pressure. Ashwagandha and draksha and bala are there. And then suddenly we also need an immunomodulator so as to protect the heart and the various organs in the body from the infections. So this it comes in 450 ml. Very very unique measuring cap, so to give the person the right dosage, and 10 to 20 ml with equal amount of water post meal twice a day or as directed by the physician. Hridayasava is actually a fortified version of Arjuna Rishta. Arjuna Rishta, if we look at it, consists of the bark of Arjuna, which is said in Ayurveda as one of the best medication in the management of heart, because it has a lot of unique properties in kind of giving strength to the heart. Draksha, Maduka, and Dhatki. And the underlying condition for which it can be used is stress, immunity, which is weak due to inflammation and the associated conditions. It is enriched with the herbs of Arjuna Rishta, along with the addition significant of herbs like Pushkar Mool, Guduchi, Ashwagandha, Bala, Shankushpe, and others. Pushkar Mool, as mentioned by Dr. Saab, it gives significant relief from breathlessness, because when there is stress, when there is hypertension, there's a palpitation, and the what do you call breathing pattern goes for a toss, and there's a problem. So Pushkar Mool helps in that. And the associated conditions of the other cardiac problems, it kind of helps this. Arjuna is there, Pushkar Mool, Gurji, and Ashwagandha. These are the ingredients of the solution. Lipistat, as mentioned by Dr. DP, is another solution that we have, which is actually clinically tested in the management of hypercholesterol. And each capsule, if you look at it, is made from Arjuna, 500 mg, Pushkara, which is 500 mg, and Gugulu. Gugulu, we all know very well that it contains gugulsterons, which has anti-lipid lipid properties, 500 mg. And it has been proven clinically in the trials that it reduces the elevated TG and the LDL levels. And on the contrary, it also increases the HDL levels and helps minimize the associated risk which are there with the cardiac and the other problems. So Lipistat is another product which is very very good, and this is a clinical trial that was done. So in the trial we can see that total cholesterol, LDL, and TG have been reduced over the baseline for the 3 months and the 6 months, and the HDL has increased from 44.5 to 55.15 over the period of 6 months. Google is there, Arjuna is there, and Pushkar Mool, and dosage is 1 capsule 2 to 3 times a day, depending on the condition for the patients. So with this, I will end my slide presentation, and I will open this session for some of the questions if any of the doctors have. Swati Pals asked the question, Dr. Kohli, that can we recommend intermittent fasting people to people with diabetes also. So, Dr.
Yes,
Kohli,
absolutely, absolutely. If they have type 2 diabetes, we find reversal in practically all patients if they stick to what we are told, what we tell them rather. And see, intermittent fasting basically is something which we have learned from the cavemen 12,000 years back. And this is the way we are supposed to be eating actually. You know, in yoga, they say that, a rogi eats thrice a day, a bhogi eats twice a day, and a yogi eats only once a day. So we are sticking to the middle part. You eat twice a day. This intermittent fasting is extremely effective for hypertension, diabetes, PCOD, heart conditions, obesity, for practically anything, because it is also a good detoxifier. And I've been doing it for the past 2.5 years, not because of any issues as such, but just to know what it feels like. And I feel so good that I don't feel like going back to my earlier habits. On a regular basis, I do this, and we find excellent results. Of course, I lost weight and lots of other benefits. But to answer your question, yes, any diabetic can have it, but except that it should not be type 1. If it is type 1, then we have to be very careful about it. We can still do it, but be very, very careful. It has to be done under proper supervision.
Okay, there's another question, Dr. Saab, that says that please guide about the management of hypertension in pregnancy, because that's a very critical and a
Yes.
little tough subject, sir. So, would you like to
Yes.
throw some light on that?
Yes, I think we still apply the basic principles in pregnancy hypertension also. Of course, we have to be careful and uh, keep checking the blood pressure regularly. And if it shoots up, then we have to take recourse to some rapid blood pressure lowering medications also. We may have to do that. But other than that, the principle is just exactly the same as what we are doing otherwise. You see, detoxification, which I've learned from Ayurveda only, detoxification must be done for all diseases. The level may differ. You may not resort to very drastic methods in pregnancy, but regular detoxification must be done, because if by regular what I mean is you can easily do oil pulling, you can do massages, you can do dry brushing, all these common things you can do at home, which will help in regulating the blood pressure also. Along with that, if you give these supplements or use any of the Ayurvedic medication which you have mentioned, they can be added on. But be careful that if a person is heading towards a toxemia or pregnancy or things like that, that of course is a medical emergency. And then you might have to take recourse to the usual conventional allopathic treatment for that.
Dr. DP, one of the questions that has come is how is Stresscom different from the normal ashwagandha, and can a person who is already on some allopathic medication like amlodipine and others can also take that? So, sir, would you like to answer that?
Yeah. So the first question is the dosage of Stresscom. So dosage of Stresscom we recommend is one capsule 2 times a day, morning and evening. So preferably we prefer it to be taken with milk. Reason being, as I told you in the beginning, ashwagandha increases stimulates pitta. So to mask the effects of increased pitta, we recommend it to be taken with the milk, because as everyone knows, milk pacifies the pitta dosha. So that's the only reason why we recommend with pitta. But otherwise, for a vata kapha person, it can be taken with lukewarm water, 1 2 times morning and evening. That should be sufficient. I hope the dosage part is clear. Now, Stresscom difference from ashwagandha. This is a very important question. Stresscom contains only ashwagandha, nothing else. So Stresscom is the pure root extract of ashwagandha. So that's what we have done. But what we did is we have taken the complete extract of ashwagandha. So here, if you see the principles of the Ayurveda, we see that every drug acts on its Panchabhautik Tattva, right? So to get that Panchabhautik Tattva, so we have taken the Ashwagandha ka total extract. When I say Ashwagandha total root extract, it's the root is the only useful part in Ashwagandha. So we have taken the root and total root. Total root means it contains the solubles of the alcohol soluble, chloroform soluble, benzene soluble, water soluble extracts. So all the solvents, usually what happens, somebody gives you the only water soluble extract, right? Somebody gives you the alcohol soluble extract, somebody gives you the benzene soluble extract, somebody gives you the chloroform extract. But every extract has a different mechanism of action, right? But Ayurveda doesn't believe in the specific extracts. I would like to mention here again, few years back, if you everyone remembers, few years back, one company launched a product called Mega Mind Brahmi extract. So what they have taken is they have isolated bacosides, because bacosides is the active molecule of the Brahmi. So they have isolated bacosides, chloroform extract, and this bacosides rich Brahmi extract, the branded as Mega Mind, and promoted very aggressively through mass media, through doctors, etc. But unfortunately, the product bombed. The product didn't deliver the desired results. Why? Because Brahmi doesn't act only because of bacosides. इसके अंदर बैकोसाइड्स के अलावा बहुत सारे ऐसे एक्टिव मॉलिक्यूल्स है, पेक्टिन्स है, अल्कलॉइड्स है, बहुत सारे एक्टिव्स है व्हिच आर आल्सो हेल्पिंग बैकोसाइड्स. बैकोसाइड इज अ मार्कर कंपाउंड, जिसके अंदर बैकोसाइड है वो ब्राह्मी है. सो दैट इज अ मार्कर कंपाउंड बट नॉट द ओनली एक्टिव मॉलिक्यूल. So similarly in ashwagandha, so some extracts contain vithanolides, some extracts contain cytoindicides, some extracts contain various pectins. So all these cytoindicides, vithanolides, pectins, everything is useful. So what we have done in Stresscom is we have taken the root and extracts of all solvents, methyl alcohol, ethyl alcohol, benzene, chloroform, and water. So all these extracts put together, again we put these extracts into an oil base, right? It is the base. If you see the Stresscom capsule, if you puncture the capsule, you will see the oil coming out, because this is the only product. Stresscom is the only product in market having ashwagandha in a soft gelatin oil-based capsule. Why oil? Now the question comes: why is it different from ashwagandha? Why oil? Because in Ayurveda, in Bhaishya Kalpana, Rashastra Bhaishya Kalpana, we learnt a principle: संस्कारो ही गुणवर्धनम. जिस प्रोडक्ट को जैसे संस्कार करेंगे उतना गुण ऐसे वर्धन होगा. ठीक है, दैट्स द प्रिंसिपल. नाउ व्हाट इज द प्रिंसिपल हियर इन अश्वगंधा? if you read ashwagandha ka pharmacology in ayurveda, there is ashwagandha churna, ashwagandha adhishta, ashwagandha leham, ashwagandha tailam, ashwagandha ghrutam. Various preparations of ashwagandha are there, and every preparation has different action. Ashwagandha churna, if you remember, ashwagandha churna, all the doctors might be knowing, ashwagandha churna is a brahman, so anabolic agent. So for the weightlifters, for the athletes, to improve the muscle power, for the boxers, etc., ashwagandha churna is very good because that increases the muscle power. Brahman increases the weight. So for the lean people who want to increase the weight, ashwagandha churna with milk does wonders. So that is a Brahman. Ashwagandha rishta is a very good rasayana vajikaran. So it is the overall tonic antioxidant. Ashwagandha rishta is a very strong antioxidant, rasayan. It's a very good vajikaran. Sexual wellness improve करने के लिए ashwagandha rishta is the number one tonic, because that is the medium, because the medium here is the alcohol base. So that is a different action. Similarly, ashwagandha leham is a oil base or a ghee base. Ghee base ashwagandha acts at the brain level. The product has to enter cross the blood-brain barrier and act at the psychosomatic level to reduce the stress, to reduce the anxiety, to reduce the cortisol level. Ashwagandha churna can't enter the blood-brain barrier, cross the blood-brain barrier. So if one has to cross the blood-brain barrier, ashwagandha ghrutam, ashwagandha leham, or ashwagandha kind of ghee preparations, lipid preparations are required, right? So that is the reason. If you see ashwagandha Ayurveda literature, ashwagandha ghrutam is indicated in the Brahma, Unmad, Apasmar. So that is the indication. Ashwagandha churna is not indicated in Brahma. So where there is a psychosomatic conditions are there ashwagandha ghruta lipid preparations are indicated. So that's the reason why we have indicated the capsule, soft gelatin capsule, oil base. This oil based technology and ensures the capsule, the ashwagandha extract goes to the blood-brain barrier, enters the blood-brain barrier, crosses the brain, and enters reduces the cortisol levels, thereby reducing the stress. If the stress is reduced, immunity levels will be improved. So that is how Stresscom is totally different from ashwagandha. So there are many preparations of ashwagandha in the market, but this soft gelatin technology is the difference of ashwagandha against the Stresscom. Hope I'm clear.
Yeah, I have a question. Uh, Thank you for a beautiful explanation about ashwagandha. I was not aware of all that. What I want to know is that I understand that it should be given with milk. Now, as part of our intermittent fasting and diet protocol, we tell patients not to have milk at all. So, what would be the option? They are allowed, almond milk. They are allowed coconut milk. Could they be used, or what should we do for that? Or go in for A2 cow milk or something like that?
No, no, they can take the almond milk. They can take the, yeah, almond milk is recommended. Otherwise, the
Okay,
best option which we recommend is the simple lukewarm water.
okay, okay, okay.
That is the best thing. If
Right.
the milk, if there is any problem of taking any of the milk or milk products, the best thing
Mhm.
which we recommend is the lukewarm water. So that is
Okay.
the best thing, suits everyone.
Right. Thank you. Thank you. I got my
Thanks.
answer. Thank you.
Thanks, sir.
So, Dr. Kohli, there's another question from a Dr. Preeti. She's asking, please guide us regarding the management of hypertension in kids and teenagers. So, this is an alarming situation which is coming up, right, in kids
Yes.
and
Yes.
teenagers also, right, Dr.
See,
Kohli?
the thing is that as far as kids are concerned, we'll take up the teenagers later. First, the kids. Now, as far as kids are concerned, the possibility of they having a congenital problem is much more likely. So they should first and foremost be checked for coarctation of the aorta, any endocrine problem, things like that. So if that is what I mean to say, that they are likely to have secondary hypertension. So if they have secondary hypertension, that needs to be corrected. So if there's coarctation of the aorta, that they will require surgery for that. So you try to rule out a secondary cause for it first. So I think in almost all patients, this is what you're going to find. When you come to the teenagers part of it, again this principle applies. You got to rule out a congenital cause first. If there is no congenital cause, then you think of it in terms of it being a primary pathology. If it is a primary pathology, then again the same principle has got to be followed, though it is a little difficult with teenagers. The principle will remain the same. So you must not forget that young people are more likely to have a secondary cause of hypertension, and primary is a little less likely. But if it is primary, then you treat on the same lines as in these. We are not discussing the allopathic drug treatment, because that I personally feel that we have to do away with as far as possible.
So, Dr. DP, would you like to add from an Ayurveda perspective for the kids and the teenagers, sir? Hello.
Sorry, no, because I didn't, I haven't come across any such cases. Yeah, I don't have any such references for the management of hypertension in the kids, particularly.
Great.
I don't have an experience.
Okay. So maybe, sir, one doctor is asking about Lipistat, since it is for this management of cholesterol and all. So how does Lipistat is unique, and can a patient who's already on some statins and others, can he also take along with that? So Dr. DP, would you like to answer that, sir?
Yeah, first thing is, while a person is onto any cardioprotective drugs like statins, etc., they can safely take Lipistat without any hesitation. What it will help is it will help to reduce the statin dose. So it will complement the effect of statins, and thereby helping the overall cardiac health. Number one, the uniqueness of Lipistat is, as I mentioned earlier, it has uh, a diuretic is there, a cardioprotective is there, and a anti-cholesterol agent is there. So three agents are there in the Lipistat together in equal proportions. So Arjuna is a very strong diuretic. So, as I mentioned in the past, in the beginning, hypertension as a symptom will have its adverse effects in all the vital organs, be it kidney, be it in the heart, or be it in the brain. So, if we take Arjuna as a diuretic, Arjuna as a it protects the kidney health, right? While improving the systolic pressure, while improving the cardiac heart muscles to pump more blood, it is also recommended as a very strong, very good diuretic or the kidney protection in the Ayurveda. So that's the role of Arjuna. Pushkar Mool is a very strong cardioprotective. So it improves the cardiac muscle health. So Pushkar Mool. And the third one is Gugulu. As everyone knows, it maintains the optimum weight. It also reduces the extra blocks or extra cholesterol and the triglycerides happening in the body, ensuring the proper circulation. So these are the three agents put together in the Lipistat. So here I would like to inform to all the my doctor friends. At Dabur, we also do cultivate some specific plants, medicinal plants, which are going extinct or which are very important for Ayurveda. Like high altitude region में जो plants growth है, तगर हो गया, कुष्ठ हो गया, मंजिष्ठा जैसे plants को डाबर अपना चिरायता जैसे plants डाबर cultivate करके अपना medicinal plants में medicinal products में use करते हैं. One among them is Pushkar Mole. So with the Lipistat, I am sure that Pushkar Mole being used in the Lipistat is of the best quality, which Dabur cultivating in the high altitude regions. So that is a assurance from the raw material side as well. So that's how it is different. And of course, we have a very good clinical trial by one of the important cardiologists from Mumbai, Dr. Lekha Pathak. She herself tried this product in the cardiac patients where there is an established case of CADs were there. So in the patients where there is a recommendation of the cardiac procedure, surgical procedure is there, in 8 of the 20 patients, the cardiac procedure could be avoided. So after taking the Lipistat, they could avoid the procedure, and with the medication only, they could reduce the complications of CAD. So that's how it is very important of the Lipistat.
Many thanks, sir.
If I
Dr.
may
Kohli? Yeah.
just mention something, as far as statins are concerned, we now in functional medicine tend to not use it too much. Like those who do not have a cardiac problem, we avoid using statins at all in the first place. So Lipistat would be an excellent alternative for that. In cardiac patients also, when we have to give the statins, then I give a very small dose. And I generally try to put them on Lipistat only so that they don't need to take any of those. But if at all there has to be given, I would advise probably like 5 milligram on alternate days of some atorvastatin or something like that. For the simple reason that cholesterol lowering is not what is important. The body needs cholesterol. What is important is reduction of inflammation. And inflammation does get reduced to a certain extent by statins. But if you resort to good lifestyle, detoxification and proper lifestyle, you're already taking care of the inflammatory part. So statin becomes redundant. But Lipistat becomes important because it has other functions as well.
Correct.
Thanks, sir.
So-
Thanks, sir.
Thank you so much for the detailed insight, sir. And I think with the insights thrown by Dr. Kohli and Dr. DP, I think many of the doctors, especially allopathy doctors, also who have an interest towards the complementary medicine and integrative medicine, right? They will be definitely very much benefited, and also Ayurveda doctors who are looking to help the patients in the management of hypertension. So I think we have run out of time, sir. It has been a pleasure to have you on the show, sir. Many thanks for sparing your valuable time, Dr. Kohli. It was a pleasure learning some of the insights about the management of hypertension, such a challenging condition, and you made it so simple. At the end, saying that laugh is very important. So that is very important, sir. Managing hypertension. Dr. DB, sir, would you like to have the final word, sir?
Yeah, I would just like to add one more thing, sir. In fact, I forgot at that time. One thing which I would like to add, maybe I think Dr. Kohli sir could be the right person to add. While in the Ahara, one thing which I would like to add is the music therapy. Music therapy is also one of the very important factor in reducing the stress and hypertension, which I experienced and I recommend to many people. Whether you listen to your favorite music or you yourself participate in music of your favorite songs or dance, because they're all expression of relieving the stress, whether you sing or whether you dance or whether you laugh or you're doing. So there are the ways of relieving the stress in various measures. So even because in the alternative systems, Kohli sir, music therapy is also one of the therapies mentioned in way back in our Puranas. So I think people can resort to music therapy as well in case of such lifestyle problems. This is a very wonderful therapy to get a good sleep, and to get a relief of hypertension.
Could I add something to this? This is a
Yes, sir.
wonderful observation, and I should have included it in my slides. One that, again, I'll go back to Ayurveda first on this, that Ayurveda has also described, I'm sure you know more about it than I do, that for different types like Vat, Pitta, and Kapha, a different type of a music is synchronous with you. So, one, that is something which you can do. The other thing is, all music comes from Anhad Nad. So, if you can connect to that, which yoga has described, nothing could be better than that. If you can hear the inner music, then you are in perfect shape.
Yes, yes.
That's all I wanted to say. Thank you.
Yeah. Thank you, sir. Thank you.
Sir,
Thanks, Anuj.
I must say that it is a music to the ears listening to both of you, sir. And I'm very sure for all the doctors also. I'd like to thank you, Dr. DP, and from the entire family of Dabur. Thank you so much. And I hope that we continue doing such interactive sessions for the benefit of the entire medical fraternity. Right. I'll also like to place on record thanks for our digital partners, Dr. Piyush and his entire team of Indian Vedyas for making it so seamless. Thank you, Dr. Piyush. And we look forward to hosting another webinar in next month. Till then, from all of us from the Dabur India family, stay healthy, stay safe, and namaskar. Thank you so much, sir. Thank you.
Thank you.
Thank you.
everybody.
Thank you.
Thank you.
Thanks.